Hello, everyone. My name is Damian Julian, and today I'm going to be discussing a little brief presentation of a video that I found on TED Talk. Now, the video that I found is called Your Health Depends on Where You Live, and it's by Bill Davenhill. Now, having watched TED Talks before for some of my previous classes, I'm definitely pretty seasoned when it comes to watching some of these videos. Now, the goal or the assignment was to research on videos pertaining to health and wellness. So I just simply went to the search engine and typed in health and wellness. And the first video that popped up was one that really intrigued me. And that was that video that I just mentioned, which is Your Health Depends on Where You Live by. Now, the reason why I chose that and didn't go through some of the other videos is because I've had a lot of thought about this over the last month in regards to our environment, and I'll go over that a little bit later. But let's get into the thick of things. Does the environment affect our health? And Bill Davenhill discusses that, in fact, it does. And at one point, Bill had a heart attack, and he found himself in a hospital. And while in the hospital, if you're all aware, or if you haven't ever been to a hospital and something serious, there's a whole bunch of paperwork that you have to fill out. As he's filling out this paperwork, it asks, family history, what are your life choices? Do you exercise? Do you eat healthy? So on and so forth. And the one thing he thought should be asked was, where have you lived? Now, Bill's background is creating software and technology that brings together geographical areas that are in need of medical needs. He started this back in the 70s through the 80s. Well, as time went on, he started to figure out that this same data is showing areas that are high risk or they have higher numbers of people suffering from major health concerns or crisis. Having that background, again, he asked the question, well, why aren't they asking about where I've lived? He did some research and he noticed that throughout his life, he lived in areas that were high in toxins. It's a lot very well documented toxins in the Midwestern areas. And he lived in California, which has a lot of toxins due to pollution from automobiles and so on and so forth. Now, what I take away from that is that it should be considered. And I'll explain why. I'll tell you a little personal story, and it's a little sad, but it's reinforces why I chose this topic. If you don't know about me, I played semi-pro football for 18 years, and when I first started playing in the year 2000, I met a guy, and he became my best friend, and his name was Tremaine. He grew up in California. Well, several weeks ago, he's a year older than me. Tremaine passed away from a heart attack. Couldn't believe why. I was like, man, he wasn't. I just saw him a couple months ago. He was in relatively good shape. I'm not saying that he was a health geek and exercised all the time, and I can't say he ate the best food, but he was in good shape. Thin guy, not overweight or anything along those lines. And then I started taking into consideration some video or some articles I've been reading about the effects of the fires on our health here in Colorado and in California for that matter. If you think back to those days during the summer, I mean, think about all the times you woke up in the morning and there was ash all over your car. Sometimes the ash was so significant, it was like chunky, like you were just sitting next to a bonfire or something. I kept thinking to myself, man, I know we're trying to protect ourselves from contracting COVID. What about what is inhaling or ingesting this ash causing to our health? And then of course I come across this video. But prior to that, I did some research and I mentioned it, I outlined it in the article that I wrote. There was an article from Emily Emery from the UC Health Department right here in Colorado that talks about how the smoke fire or the smoke from the wildfires um, is a major cause of concern for our health, especially for those people suffering from um, cardiovascular risks, things along those lines. And then there was another article I read from Robert Lee that talked about how, due to these fires, there's been a 43% increase in hospitalizations resulting from strokes and other cardiovascular conditions. So then I thought, is that maybe why my friend passed away at such an early age? And it just goes to reinforce what Bill Davenhill was talking about during his TED Talk, is that our environment does in fact affect our health. These articles that I've mentioned do in fact reinforce that our environment does affect our health. The wildfires that we've experienced will in fact affect our health now, and from the documentation that I've read, will continue to do so for several more years. So we don't even know the ramifications of those fires will have on our health. To add a little bit more, it made me think about my own health. Now, for most of my life, I've been a very active person. I've always exercised. I've always ate healthy. I just stayed away from. I never did drugs or anything like that. Never smoked. Yeah, sure, you have wine or beer, but always in moderation, nothing over the top. And I always felt like I've always been a very healthy person. Even after I retired from football, I still maintain a high level of activity, which is why I am an advocate for not just physical education, but physical fitness and wellness, not just as for kids, but for a lifetime. But COVID has in fact made an effect on me, and I haven't been able to work out like I normally do because of the restrictions of COVID and my gym being reduced to so many people. And every time I try to reserve a slot, it's full. But that's just the way it goes. But I have gained some weight, so decided to go down to the doctor, got a physical. Doctor came back letting me know that, hey, your liver function isn't where it should be. I'm thinking my liver, like drink tons of water, I'm relatively healthy. He says, well, it doesn't necessarily mean anything. It could be from, well, you don't drink extreme alcohol, you don't have hepatitis C, but it could be because other organs aren't performing at the level they should be, like, and he mentions my heart. Now I'm concerned. I do have a follow-up appointment, but with everything that's all happened, it's really made me refocus on making sure, regardless of COVID or whatever the circumstances are, that we have to maintain a healthy lifestyle. We should always eat healthy and be active. And that's what I got out of this video. I think it applies not just to me, but it applies to everyone. And I think we do and we should be proactive in our health and our health checkups, regardless of how old you are, because this is affecting young people as well. In fact, they mentioned it has a higher effect on children as because their bodies are still developing, their lungs are still developing. Maybe a person doesn't have a life-changing event like I have, where a friend passes away at an early age due to an unforeseen heart attack. But this video by Bill Davenhill is available to the public. And, if people are researching, this video is there for them and available. And that's why TED Talk is good when it contains the dimensions of wellness. I don't want to take any more time. Thanks for hearing my story. Stay healthy, stay active, and take care.